Alrighty, you guys. I'm so excited today. I have my good friend here, Jasmine. I don't really know how she does it all. We were just talking about how she has an incredible daughter that is almost 2 years old. We get into a little bit of that today with balancing that with, motherhood, dental school, all of that. And she's also in an oral pathology residency program. So that's kind of where I want to get started because honestly, I feel like when I was a pre-dental student or like even like outside of dentistry, a lot of people don't know that much about oral path. So give us a little bit of a rundown about like what it was about oral path that you really loved and like how you knew you wanted to specialize in this.
Sure. Okay, so a little bit of background about me. I was born in Israel, but I came here I was 4 years old. My dad's a jeweler and my mom like worked at a bank and then she joined like the family business later on. So like a very tight-knit like family, small business owners, things like that. And actually funny, like my dad works through a microscope because he's a jeweler, like he's a diamond setter. And he works with burrs and like a lot of the things that we work with, castings, things like that. So
Loops also.
yeah, exactly. Like I was around these type of materials like my whole life. And then like as a kid, I always like really liked science and math, and I always knew I wanted to get into that. Um, and I knew like when I went to college, I didn't want to do biology. Like I don't know, I wasn't like a bio girl. I was a chemistry major. So I know you're a pharmacist. So
Yes.
like chem girly all day. And then so I got a degree in chemistry, and then so I always had a more like of interest in like science, and like I always knew I wanted to teach. I was tutoring in undergrad, and then in dental school also I worked as a tutor. I used to work in dental offices before dental school, and I was like a dental office manager, dental assistant. I know billing, like I did every single position in the dental office, and I truly have like a love for the small business side of it, right? Because like I grew up.
Was there ever like a part of you that was like, I would ever like work for my dad, like in his jewelry business? Did that ever cross your
Yes.
mind?
Definitely. Like I love jewelry, and like that's how I express myself like to this day. Like I consider jewelry to be art, and my dad actually makes some of the jewelry. So like it's super cool. Like he designed like my engagement ring.
That was my next question.
Yeah, we got a family hookup over there, but it's definitely something I considered. But my parents are very like they're like real deal like immigrant parents, and they're like, we brought you to this country like so you can be a doctor, and like we didn't have these type of opportunities. And I was like, I always found like comfort in school because like school was my thing, and like I always like loved it. Like I like that idea that you study, you get the exam grades, you get good opportunities, and like I always loved that. Like I really appreciated like the opportunities that like school has given me. And I was really fortunate to get into dental school right out of college and graduate young. And I'm still, like kind of similar to you, how like even you did pharmacy, and but like you kind of take advantage of these opportunities, and like you have an appreciation for them. And that's the kind of family I grew up in. And it definitely, even now I consider it, because like it's such an amazing business. And like part of me, it's like I don't want to see the family business not succeed and get passed down to generations. But we'll see.
Honestly, that's the really cool thing about dentistry is I know so many dentists where like they work up until a certain point and then they can actually start pursuing other things. So maybe it'll come to a point where like eventually you can have a double life and like take over the jewelry
For
business as
sure.
well. When you were in school, did you ever have any sort of like doubts or like questions about your future in terms of like pursuing oral path, or did you consider any other specialties?
For sure. Like when I was working in private practice, like I knew there's certain procedures I love. One of the doctors I worked for, one of my mentors, he did an implant fellowship, and he really invested heavily, and we did a lot of surgical cases, and I became like really obsessed with surgery. And like the more gory, like the better. I really love it. And
Yeah.
the only thing was, as I started to pursue, like I really was like interested in pursuing like surgery residency, like OMFS. But the way that things turned out, like I had a kid in dental school, and I just had to really look at my life like objectively, and think like, how do I want to invest my time, and like what kind of lifestyle do I want to have. And like surgery lifestyle is very demanding, and like I really give it to my oral surgery colleagues, especially the women, because it's very challenging. It's like of course nobody wants to talk about it, but like we as women don't have the luxury that men have, you know, that we can't have kids forever, and there really is a prime time. And you put your life off for your education? Like you come to like a crossroads, kind of like as a student and like as a mom, as a fiance, as a wife, whatever, and you decide like how do you see your life? And I started to realize like I love the hustle and I love the work, but you know, that's not the lifestyle for me, and that's not what's meant for me right now. And the closest thing like to surgery is pathology, because they work hand in hand, you know, like like what do I really want to know? Like I want to know all the pathology, I want to know the disease process, I want to be able to manage patients like medically and dentally. And that's what I love, like really what intrigued me. And that's kind of surgery and pathology are on the borderline of that, and some other specialties too. You know, we're not just dentists, like we manage the whole oral cavity, we diagnose. Oral path is such a big part of dental school education, because you're not exposed to these things, and when you are exposed, what do? You know, how do you monitor these patients? Like some of my colleagues, like in oral path, they were clinicians for many years, like they did general dentistry for many years, and then they saw so many people with dysplasia, and like the small towns that they were practicing in didn't have enough surgeons or pathologists. You know, that's something that people really overlook, that pathologists can see patients as well and manage them. You know, people think like, oh, you don't want to see patients, or like you don't want to work hard. That's kind of the attitude towards it, because like it really is a different type of work, right? You have to acquire a whole new set of skills. You have to be able to look through that microscope and see and interpret what nobody else can see. You know, that's ultimately what you're doing. You're gaining more skills. And like if I can understand what's going on at a cellular level, I can manage this patient better medically, and you know, even help the surgical team. And I can always be part of that. And you can teach and be kind of one foot in the door in academia. You could be in a hospital, and like it's really interesting the direction that oral path is going in.
Yeah, that was actually my next question too. It's like so interesting hearing you talk about the field of oral path. It's almost like you go through 4 years of dental school, and then I'm sure it's almost like when you specialize in oral path, it's like learning a whole new language, right? Because I remember when I was taking like oral path class, I was like, whoa, this is like a whole new ballpark, like all these terms, and then how you communicate with each other. And so, too, I think a lot of people don't really know that much about like what the day-to-day life is like for oral path, because all we're exposed to is our oral path faculty at school. So can you
Mhm.
tell the audience a bit about like what the job opportunities are like? Like can you open up your own like oral path sort of, I guess, like practice in a sense, or is it more like you're contracted with like general dentists, or you work with schools? Like tell us about the landscape of what it's like.
So this is actually a really interesting topic, because I'm going to talk a little bit about like the history of the specialty, because like I learned about it myself, you know, being in it. It used to be that, you know, the originators of the oral pathology specialty, they wanted to really isolate and subspecialize dentistry. So they believe like, you know, if you're an oral surgeon, you only do surgeries. If you're a general dentist, you stick to your general procedures, and you have a kind of a more narrow scope. And it used to be, in order to be board eligible, to even take the board exam for oral pathology, you used to have to practice clinically as an oral pathologist for 5 years. So that means like you would have to get a job, you would graduate residency, and you would practice for 5 years as an oral pathologist, and only then you could take boards. So it was really tough. Like that's something like my program director was telling me about, and like I couldn't believe it, because now like we finish residency, take boards, get board certified. So it like, and it used to be kind of frowned upon to practice anything outside of your scope. So like if you would do anything procedure based, like, you know, more extensive biopsies, I'm that would be kind of considered beyond the scope. But now the rules aren't so strict. It depends what state you're practicing in as well. So like in New York, for example, you know, we're oral and maxillofacial pathologists, but what do you describe as like, where does the oral cavity start and end? And maxillofacial, you know, the thyroid, the neck, like there's certain things. And like that's one of the good things about a hospital-based oral pathology residency program. You get exposure to like ENT pathology and derm pathology, because it's a lot more integrated. You could get a basal cell carcinoma on your lip, you know, you could get a squamous cell carcinoma on your lip, you could get all types of other things things that are completely benign. I'm sure, I don't have to give you the rundown and traumatize any of our listeners, because it's really not that bad. I know some people are really traumatized from these courses because it is hard. Like, it's truly a hard skill to acquire, and it is different than, kind of doing more clinical procedures and being more repetitive. Every biopsy is different. And like now it's going in a direction where there are more people opening up private practice oral pathology. Now it's much more diverse. There's much more opportunity. And that's kind of what I'm interested in, like this new age of integration. Like, why are we practicing dentistry as if the oral cavity is isolated?
What are some of like the more memorable or like, interesting, crazy cases that you've seen so far with oral path?
There's definitely that's a thing that really drew me in, right? Like the shock factor. Like you see those pictures, you're like, whoa, what is that? And
Right.
as a general dentist, you could get really scared. Like you don't know what to really tell the patient. You don't know where to go and proceed. For me, the most memorable cases are the like really young patients, more like aggressive cases, like maybe lymphomas, things like that, without giving too much away.
Hmm.
But that always gets me, like when I see a case or of a patient who's like in their 20s and diagnosed with a really aggressive, like let's say sarcoma, or it really makes me appreciate life. Like I have to remind myself that I'm in a city that I see these very rare cases, because it starts to kind of like freak you out a little bit, like so much, and like I'm sure everybody gets to a point in their education where they're like, oh my God, no, like, do I have this? Do I have this? Like, you know, you know what I'm talking about.
1000%. Yeah. And thinking about the weight of like what you deal with oral path, there's like a lot of heavy stuff, like you were saying, like
Right.
heavy cases. Two questions with that. One, what are your best, like, do you have any advice for kind of delivering that hard news? Because I'm sure it never really gets easier, but you probably become better at having those difficult conversations. So you have to break to someone that they have an aggressive form of cancer. Like, walk us through like how you've learned to approach these situations.
It's just thinking about, every day I walk into the hospital and I'm like, and even when I walk out of work, like I try to just like appreciate like my own life, and like I try to think like every encounter like I have with any patient, like for me it's just a part of like my day and like my job and my training, but for them it might be like the best or worst moments of their life, you know what I mean? Like
Mm,
it's going to be very memorable for them. First, I always say like it's best when you have a diagnosis, because the worst thing is when nobody knows what you have, because you feel as a patient helpless and hopeless. You can't get answers, you can't get treatment. But if you have a diagnosis, you can get treatment. And that's really important. Like the being proactive, going to, get these biopsies. Like a lot of the time, like, you have to get pre-authorization for a biopsy. The patient's insurance may not cover it. By the time the patients get to us, there's a lapse of, it could be a very important phase where that patient could have been treated. And that's why, like, I really love like this field and like what I do, because I feel like you can intervene at a moment where it's truly critical, and that can change that person's prognosis for their treatment and their life. You ultimately do get desensitized, but try to use it in a positive way and like comfort the patient. Also, I have like my own experiences, like my mom is a breast cancer survivor, my grandma's a breast cancer survivor, my grandpa passed away from pancreatic cancer. I've literally been around cancer my whole life. Like it's my job to learn it and look at it and identify it. And it's just like I truly believe that like one day we'll find the treatments we need. And like I have a very hopeful outlook on it. Like I have to be positive, and like because otherwise, what are we
like,
doing?
what's the other option?
Yeah, like
I have a question. This is an
yeah.
honest question. Have you ever felt, I guess more so like in the very beginning of training, but I look at oral pathologists as like geniuses. You guys are like walking, talking encyclopedias of
Yeah, textbook,
knowledge,
a textbook.
all
I
up
get
in
it.
here. And I'm like, man, did you ever feel this sort of pressure that you have to, because like we refer to you guys when we don't know what's going on, right? You guys are the end it, like you're the
The
ones that
end
are
goal
supposed to
goal.
know what's
Yeah, yeah.
going on. So like what's it like managing that pressure of being like, oh, I have to be the one to know this? Like does it ever get to you, or is it not really a thought because it's so busy trying to just figure it out?
It's a really, really good question. And it definitely like that moment when I realized that, whatever you do in general dentistry for like more or less, like you can fix those mistakes. But like if we make a mistake, like sometimes those are not fixable. And like that really dawned on me, and it made me realize like the severity of like what I'm doing and how important it is, and like gave me a new perspective. But I also see it's very stressful, and part of the stress comes from, you know, like every surgeon operates differently. It's actually very interesting. Like surgeons have the autonomy to send to any pathologist they want. You have to learn how to work with the surgeon, and you know, what is he looking to get out of the diagnosis, and how is he going to manage and treat this patient. And like you're building a relationship with the surgeon, but also ultimately you're describing like what you see under the microscope. And like you said, there's this time sensitive manner, like patients are freaking out, you know, and they want to know what they have, and they're calling the surgeon every day. The surgeon is calling the pathologist, and sometimes like when the diagnoses are not so straightforward, we have to order special like immunohistochemical stains. We have to get another biopsy in a different area. We need that biopsy to be in a different solution. Like there's so many complexities to this. So there is that pressure of like when they call, like they expect you to have the answer.
I love hearing, you describe the process with the surgeon because I feel like this episode is really going to open up a lot of people's eyes about what it is and like what the workflow is like. Two questions. One, what do you think are qualities that make a really good standout oral pathologist? And two, what is like the dream career goal for Dr. Jasmin Ludy? Like, I want to know what your career goals are like.
You have to really be like, you have to have a vision for it, and you have to love it and know what you want to do with it. I truly believe that, because it's another skill. And that's the thing about me personally. Pathology is like going to be a skill in my toolbox of skills. So it's not going to be my only skill. And
Got
I'm
it.
very like adamant that like I'm young and I'm like building up my skill set now. And I know that I always want to be involved in like academia and research and even hospital based work. And like I truly love pathology, but you know, there's another aspect of it that I love, which is the clinical. And I think what makes a good oral pathologist is somebody who never stops learning, you know, because things are always changing, things are coming out, that we're renaming things. Like it's truly like an evolving field, and you know, somebody has to like do this work. So I think the oral pathology community is very like close because of that. You know, everybody who's in it, because it's so small, they try to really contribute a lot to the field. And for me personally, like I know I want to practice clinically as well, and I have an interest in like pediatric oral pathology. That's what I did research in. And um because my acceptance process is a little bit different from the match, because it was pass, that kind of, you know, I had some time in D4 to think like, what do I really want to do after my oral pathology, and what kind of avenues are available to me, and what can I do with this skill set. And I think for me, ideally, I would do another 2 years of residency for peds, and I would get kind of like that surgical clinical training in like pediatrics. And you know, because I know now all the pathology, so now I can apply that. And there's a lot of kids like with special needs, managing them with syndromes, and like they have like vascular anomalies, things like that.
Oh my gosh, that is like so inspirational. I had no idea. Granted, I think I like really just didn't really know the scope of path in general. I didn't realize like you could kind of combine the specialties like that and do more after. I mean, it totally makes sense. Wait, can I also just say, everyone, this girl is such a boss. So you listen to what she did during like COVID times when when like times in clinic were restricted and we couldn't really use our hand skills. This girl invested in herself and you got one of those like mounted mannequin handpiece situations, right? So you could like
Yeah,
practice at home. I was
I
like
was
so
shook.
like I was like, oh my God, this girl is so cool because I always say that. I'm always like, man, I wish that I had this at home so I could practice it more. Like you were just such an
Such
icon for
a, no,
that.
it's literally like such a, like you get it because like you're a cancer. It's like such a cancer vibe. Like you set up at home, you have like your candle, you have like
Hmm.
your beverage, you're
Yep.
chilling. Like it's the best thing ever. Also for me, I was shook because I was like, oh my God, they close these dental offices. Like I need to practice for myself. And like, what am I gonna do? I literally called up the company and I was like, hey, I'm from NYU. Can you give me the student discount? And they were
And
like,
they
oh,
did.
we're running low on supply. Let me see if I could ship one out to you soon. And I was like, okay. And they even sent me like the Amazon link to the compressor, and like I had the compressor, everything, the whole setup.
I feel like it's so inspirational to me personally when I see students kind of like go against the grain and do something that's not the norm,
Yeah.
because I don't know if you felt this way, but I feel like especially in professional school, in pharmacy school, but especially dental school, sometimes it almost feels like you're in this bubble where everyone's like looking at what everyone's doing, everyone's comparing, and it's almost like you don't want to stick out because you're like, oh, I don't want people to like judge me for
What I'm
whatever
doing.
I'm doing. Exactly. I don't really understand like why or where it's coming from, but in dental school there's just this kind of like ego almost, I think. And so I find it really refreshing and inspirational that you were just like, no, I need more experience. I'm just gonna get myself the whole ass unit and just
I'm
practice.
just not that girl. Like I'm just like a honestly, I'm telling you, I just that was something that I really struggled with in dental school. I felt like everybody for especially in the beginning wasn't being real, and like for somebody who, I was like struggling, like I was commuting every day, like I needed support like at the time, and luckily I was able to find it. I was able to find a good friend group. I was able to get into therapy, and I was able to like take care of myself. Actually, I started doing so much better when I started studying less and like taking care of myself more. But that was a hard lesson I had to learn, that like, hey, you're not gaining anything by sitting 13 hours a day. You feel depressed because you're not taking care of yourself. And like there's things you could actually do to like help yourself. And part of that was kind of letting go of this like toxic like culture and like ideal of like everything is perfect, you're supposed to be perfect, and like you're not supposed to struggle at all. And I went to a really big school, and you can kind of get lost in the mix, like if you're not asking for help and if you're not advocating for yourself. And I was like, no, like I made a conscious decision that I'm going to do what I want to do, and I'm not going to apologize, because life is short, and it's too short to be unhappy and to not try. Like I would try anything and everything, like when I needed that help, and like I would ask anybody, and like what's the worst that can happen? Like they'll say no. And that's one thing I will say, which is like I'm so happy I went to NYU, and like I'm so happy I went to a good school, because it really like brought me out, like it brought out such good qualities of me. And like I
Mhm.
was able to invest in myself in a way, like I used so many resources, like I was like on the peer review board, and like I went to these like leadership conferences, just like amazing experiences that like really develop your character, and like give you kind of that support you need, like that self-confidence.
Speaking of like, who you are and your identity and all of that, that's kind of where I really want to hear from you about motherhood, because I feel like that's like the ultimate like game shift of like your sense of self. So kind of walk us through what your thoughts and feelings were when D3 May, when you found out you were pregnant. Like what was it like going through pregnancy in dental school?
Really interestingly, I was never gonna get pregnant in dental school. I didn't even want to get married in dental school. The
Really?
plan was, yeah, I got engaged the summer before dental school, because my husband and I were like at the time we were living together, and I was like I don't have time, like I need like to know that like emotionally and like physically we're just in this 100%, because like I'm just a person, I need like reassurance in my relationship. And like at the time that's what I needed, and like I felt that we were together long enough. And he also like reciprocated those feelings, and we got engaged, and there was no pressure kind of to get married from my end, or like I never wanted to. I was ready to be engaged for 4 years, 5 years. I was just happy to like be engaged and to like live and enjoy our life. So when I started dental school, like time just like was going, and I was just, we kind of looked at each other like after D1, and I was like, he's like, what are we waiting for? I'm like, I don't know, what are we waiting for? And then we were like, I knew I didn't want a big wedding, because like I didn't want it financially and I didn't want it physically. I was like, that money is like, I'd rather spend it on something else. And it's the idea, like I want to be married, I don't want the wedding, so I want the union.
Like
So
just start your life together.
exactly. And it was kind of just the next logical step for us. We got married, and like it was really nice. We did like an elopement at Yosemite, and like just like a real like testament to like our relationship, like climbing mountains together.
I love
um
that.
yeah. And then kind of like when COVID, like it was before kind of COVID when I got pregnant, but still like in during it. And I was just like, like we were home. I mean, he was still working because he was working as a nurse at the time. Now he's working as a nurse practitioner, but it was just like scary, and like it would put things into perspective, and like life is short, and like our parents aren't getting any younger, and we know that we want, a big family, and we want them to be around, and like that was always like really important for me. I always had my grandparents growing up, and like I'm really close with my grandma, and when my grandpa was alive, I was really close with him. So it like we decided like, okay, we're gonna try, and like my doctor told me like, don't be surprised if it doesn't happen for you right away, and like because I had some like hormonal imbalances and things like that, and also the stress of dental school. I wasn't expecting anything, and then I got pregnant, and then we were just like, all right, let's do this.
You're
And
like, so
then
what now?
I couldn't believe it, honestly. Like it didn't feel real. Also, I had a false negative, or it was just too early. Like the hormone, the HCG wasn't high enough, and it didn't detect it on the at-home test. I was really sick, like throwing up a bunch of times a day, and I couldn't keep anything down. I thought I was like terminally ill. The test I took that was positive, I told like Mitchell, I was like, if this is negative, we're going to the hospital right away. And it was positive, and then I didn't
Oh my
believe it. I had
gosh.
to take another one, and then after like I stopped being nauseous, I went into this like hyperactive mode. I don't know what it was. Like I had
Really?
so much energy, yeah. And that's when I started like selling my sourdough, and like I
Wait, that's like so funny
yeah, I
because that is like
literally was
so
like
telling.
I was coming to dental school with like 7 loaves of bread. Like it was
Wait,
like well, like 6 months pregnant. It was a little intense.
this is actually like so funny because it reminds me of like that COVID time where like making sourdough was like
Yeah.
a thing, and I'm like, oh my God, this girl literally started like a sourdough business from the energy from all of this like mom hormone stuff.
I was really into like, I don't know, the like mom vibes were like coming in very early with that. And eventually I stopped when like the patient care started picking up, and I was like really pregnant, and I had my rotations, and I was like, all right, I'm just tired. Made sure I was on top of my requirements because I didn't want to do anything to jeopardize my graduation. And ultimately, like, when I look back and when my daughter looks back, I want her to know, you can do these things, and I want to live in a world where, these things are possible. Not
Mm.
to say that doesn't come with challenges.
Right. I want to know how, or if you have any advice for time management, because, I have a couple of people in my clinic that are new parents as well. And like you would think being a new parent, I mean, you have so many challenges coming at you, but they're like you, they're like so on top of it because it's kind of like you have no choice
I
but
have
to
no
be on top
choice.
of it. So like let me know like how did you structure your day to help you be more efficient? Or like what did you do to just, like make it all work?
Honestly, for all my dental students that are currently in dental school and are listening, you have to go short-term goals, one day at a time. If you look in the long term, you get very overwhelmed. Like, there, and when you look back, you've accomplished so much, even in 6 months of dental school, 3 months. So you really have to take everything with like a grain of salt, and short-term goals. What do I want to accomplish today? What's realistic for me? Like, you have to really be realistic with yourself. Like, if you are practicing, let's say, preps for a practical, if you want to go and practice until you get it perfect, that's not realistic. But going and giving your best effort on 1 or 2 preps and giving yourself a frame of time, 1 to 2 hours, that's more effective. It took me a long time to learn that lesson too. I was that girl in SimLab from 6 a.m. because I'm like, I have to, it's all about the more time. But no, it's really intentional practice. I would block off my time, and let's say instead of doing like 12-hour days, I just did like double that time. Like I would study for 2 or 3 weeks for 3 or 4 hours a day. What's realistic for me,
Mhm.
time blocking, and also incorporating the things that I want, spending time with my family, moving my body. Like, again, it took me a long time to like learn these things. Even sleeping, like my sleep is the best that it's ever been. I got this ring for my birthday, the Aura ring
Oh, the
that,
aura,
yeah,
yeah. I want to try
Dr.
that.
Joyce, Dr.
Yes.
Joyce, and I always DM her. I'm like, I freaking love this. It really like it made me be aware of like my sleeping habits. And I have a really good friend from dental school, shout out Jessica, when you hear this. And she told me like in D1, she's like, you cannot, like, this is not sustainable for you. I was truly sleeping 5 hours a night and I thought that was normal. Like, I thought it was okay. Like, isn't this what everybody's doing? You know, my
Right.
classmates are in the library all night. There's always somebody working harder than you. There's always somebody smarter than you. There's always somebody who's going to have better preps than you. But the question is like, are you a good person? Like, are you doing your best? And like, are you being intentional with your time? And I feel like if it's yes to all those things, everything is going to work out. Having
Mhm.
faith is hard too, because it seems like never ending kind of. I remember that feeling. Like, I remember that feeling from what, like, you have, like, right now it's the end of January to May to graduation. I was like, oh my God, this is the longest 3 months of my life.
Yeah.
I
It's
can
like
taste it.
I feel like society wants to put us into these buckets of like, oh, she's a career woman or like, oh, she's a mom. And it's kind of frustrating because it's like, okay, the same person can be like a career-driven, ambitious woman and a mom. Did you feel at all like almost like frustration with having to like sort out this whole new identity when all of a sudden you can't practice as much as you want or you can't work as much as you want because you have like so many more responsibilities and things like that? What was it like navigating your identity changing and becoming a mother and balancing that with like the career Jasmine that you once knew?
Right. So a lot of it, there definitely was a time where I was like, I don't want to feel like I'm sacrificing, but ultimately everything in life is a sacrifice, I believe, and a negotiation. And, I didn't want to feel, I definitely went through a phase where I'm like, am I giving up a part of my career? Or like, am I, also with oral pathology, because people really don't understand what I'm doing. And like the vibes are very much like, why are you doing that? Or like somebody has to do it. Or, oh, you don't actually like want to see patients. I get it. Like you don't really want to work. And that's not my reality at all. Maybe for some people, everybody has different experiences, but I'm here to like break the stigma.
Yeah, I
And
love that.
yeah, and like when I became a mom, I'm like, oh my God, is it always going to be like choosing? Like, why do I feel like, and I genuinely enjoy spending time with my kid. Like, I had a child because I completely 100% wanted to. Like, I have the mentality that, like, my kid doesn't owe me anything. I owe everything to my kid. Maybe that's how, from like culturally, how I was raised, or I really believe like family makes you like better. And I felt ready to be a mom, but I don't know if I necessarily felt ready for like the social pressures that came with it. Cause I kind of get into this category of like working mom. And it's like, yeah, but I also juggle all the things I have to do at home. And like, even when I am with my daughter, like it is important for me that she knows that every day mommy goes to work and mommy comes home at night. And like, I always love that because like, that's the world like that I want her to live in. That like, your mom can do whatever she wants, and like I could be a doctor and I can do this residency program and I can still come home and be like mommy, and like we could spend time as a family. And like it's really important to me for her to see me in all those different roles, and I think that outweighs any of the pressures. But I think if I could like plot it on a graph as time
Uh-huh.
went on, I became less like affected by those pressures because again, like it's a conscious decision I made, even for my family. Like, that everybody's gonna judge and everybody has an opinion, especially when you become a mom or like even when you're pregnant, that people feel entitled to say something to you. Like
It's kind of like crazy and I
it's
don't
weird.
understand why or where it comes from. Also, like if the roles were reversed and men like carried babies, that kind of judgment would not
Never.
happen.
And also Loki, like it's kind of embarrassing. Like people come up to you and like touch your belly, and like when is it appropriate to have like that type of invasion of like your personal space? And like what if you're not cool with that? It's like everybody's different. I always
It's
It's so wild. And depending on what culture you're in, also like those traditions, like they try to kind of push it on you, or they try to help. It is coming from a good place because that's what worked for centuries and generations, but ultimately you have to acknowledge that we don't live like that anymore. And the first time my grandma saw like breast pump, she goes, well, she was like, what is that, like
that's so
um
funny. Oh my
but
God.
these are things like that evolve. And like I think even expectations of dads, like nobody even talks about that. Like
Yeah.
when I left my daughter at home, like my husband took his leave after my leave. So I took a few weeks off from school and I was home with my daughter. And then I went back to school and he took his leave starting when I went back because I felt more comfortable that he was there. Like we also had like childcare help sometimes, but I wanted, even though it would have been nice to have that time together, like that's again one of the sacrifices we made in
Mm,
order to have, for her to be home with one of us for longer without leaving her with a nanny, while I was in school and he was at work.
right.
People were like, oh my God, like my family members were like, are you sure he can handle it? Like, is he gonna be okay? And I'm like, first of all, like he's a nurse, he's a medical professional, like
Right.
he can do a lot. He's very capable, and like I will not be like perpetuating this weaponized incompetence. Like he is completely capable and he wants to do it. And like I'm not gonna, deter him from that because I feel like you have to, everybody needs an opportunity to parent in their way. We have a
Right.
philosophy of parenting, but I don't parent identical to the way he does. And I think he deserves to have that freedom to build that relationship with our daughter, kind of like what I have with my dad.
Has becoming a mother kind of changed the way that you look at your mother and like that relationship? Do you like see things differently now and have like a new appreciation?
For sure. I definitely look at women, like I truly look at women in a new light, and like I truly have so much respect for like the physical and emotional, just men, they're not capable of doing what women are doing. And like I think, we had a lot of conversations about that too. Like your body goes through all the changes. And I think also the pressures, like my mom always worked, and being a working mom kind of, she wasn't home, like let's say as often, because she's always working and like trying to develop and like give us the opportunities that like we didn't have, very
Mm-hmm.
um the immigrant story. But at the end of the day, like I definitely have a new appreciation for her, but I also see things how she did, and I know, what kind of things I want to incorporate like into our traditions, and what kind of things I kind of want to leave out.
One thing I have heard people say is like motherhood can be really isolating actually, even though on the outside it's like, oh, people are always sending you gifts and wishing you well. But the truth is, like when I hear my sister at least talk about like the journey, it does sound isolating. So what do you think are ways that like your friends and your family can like support you in like the best way possible?
It's actually interesting. Like, I think it's really like analogous to, let's say, like starting dental school, and like, everyone's struggling, but nobody wants to talk about it. It's kind of looked
Mm,
down upon. That's kind of what it is. You don't want to be the mom to be like, hey, like, actually, like, I need help, and like,
right.
there's this mentality that you're born knowing how to be a mother. And sure, I definitely think that there's some intuition, but it doesn't come like that for every woman. And we need to kind of take that pressure off a mom to be like, just because you're growing a baby physically in your body, not everybody has the same emotional or physical connection and attachment with their kid. And it's really hard to actually build a healthy attachment, especially when you have to go work for, after a few weeks. And like, even me, I definitely felt like, people were like looking down on me. Like when I made the decision to stop breastfeeding, it was really hard.
Mm,
Like somebody told me like you should just take like a week, 1 year off and leave school so that you could focus on like giving your kid like the best nutrition there is. And like people even told me like you're like, you're making a poor decision for your kid by not continuing to breastfeed, even though, I couldn't sustain it because I didn't really have breaks, or like it, I was, in school, and I wasn't as disciplined as I should be because I made the decision to prioritize sleep over waking up and pumping. That's a hard decision. And like people don't really take into account your personal, like people can, send gifts and like offer advice and things, but it, even when you have a support system, it's still isolating. And I think that's what is really important to talk about it. And like what your sister is kind of saying, that like you never feel like 100% comfortable to share your struggles. You never want to be judged, you never want to be the mom that's like struggling.
how do you handle the mom guilt? I guess like does it ever go away?
I don't want to say like it doesn't like loom over me like a black cloud, but again, it's like having a strong sense of self and knowing like
Mm,
I am making the right decisions, and I'm doing my best. Like really, our parents, that's the main thing I learned. Like you asked me, what did you realize about your mom? Like I realized like our parents grow up with us. Like,
Oh,
you know what I mean? Like, you know how we always joke around and I'm like, I'm literally a teen mom, like me.
yeah, yeah.
Like, I'm a teen mom. At 26 years old, I'm 100%.
I'm curious, were you always this self-assured? Like, what was little Jasmine like? Like, how did you become so self-assured or just so self-aware?
Honestly, I want to say that dental school really helped me, like, again, bring out those qualities, and like it forced me, like, because I thought, you have to be the hardest worker in the room. Like, you really
Mm,
have to outwork everybody, because that's how my dad is. Like, his work ethic is very much like, if his store opens at 12, he's at work at 6. Like,
mm.
he's there, like, you have to, if you really want something to work, you have to put your 150% into it. And like, I'm definitely, I was definitely of that mentality always. And like, I know that whatever I do, I'm gonna work hard. And like, I don't know, I truly believe like it's like manifesting and like being positive, and I just know that like everything's always gonna work out for me, like, and that
Mm.
it's gonna be great. And any failure is just like an opportunity to pivot into a different direction.
How do you think you've changed personally since having a child? Like, what qualities about yourself have changed?
I think I became they're definitely like, it comes in waves, right? Like, I'm not always like, I don't wake up and I'm like, damn, I feel like $1 million. Like, no, not like that. Like, I know a lot of people come off like, it comes off like I have it like very put together, which is like, because I really do try, and like, I pride myself on that. But one thing with motherhood is like, it's okay to like not have it all figured out, and it's okay, to be figuring things out. Like, everything is really just a work in progress, because I used to really put the pressure on myself to like achieve and perform at a very high level, and like that kind of standard of perfection, it doesn't serve anybody. The best dentist is not the perfect dentist. It's the one who is like doing it for the right reasons and looking out for the patient in an ethical way, using all their training and their skills to the best of their ability. You can be still figuring things out as a young dentist, young mom, wife, whatever, and you can be patient with yourself. That's what I learned patience with myself, and I learned patience with my daughter.
Right. It sounds like you're like better at giving yourself that grace now because you've seen
Sure.
like how crazy the whole spectrum of like life can really be now.
Yeah, it definitely puts things into perspective, and like, you have a little human. So like, now everything I do is like, how would I want her to react?
What do you think is something that, because I know you mentioned you like read all these books and articles. What's an aspect of parenting that books and articles could not have prepared you for?
It's a really good question. I think like we talked about like the social pressures of it, and like specifically like, the fact that everybody feels entitled. Like, I was truly shocked. Like,
Mm.
people were just like, I would even like, my patients in dental school, they're like, oh, you're too young to have a child and be here. Like, you can't possibly be like, or like, just like certain comments, and people, they don't think anything of it. Maybe they don't mean it, or like they just say it in passing. But as like a woman, you kind of like start to internalize these things. And like, one thing for me is I really don't want to like be resentful or bitter or anything like that. Another thing is that, like, when my daughter started to like express herself, I was like, oh my god.
That's so cute.
Yeah, it's cute, but then like, they have so many feelings and they have so many emotions, and they can't always express themselves, and like, it's hard and to watch like a child who's frustrated try to express themselves. And like, the hardest thing for me is, as a parent, you want your child to learn and succeed with your help, but on really on their own. For me, I really want my daughter to like try things and like and succeed on her own. But I it's hard for me to watch her struggle. So
Mm.
it's like that when I'm like watching her do something, like even something simple like stacking blocks, and I see like she can't stack the top one, and like she's kind of getting frustrated. I have to like it takes every fiber of my being not to like jump in there and be like, oh, this is how you do it. Like, until she asks for help, I'm not gonna intervene. Like, she
Mm.
has to struggle, and like, maybe it's like a metaphor, or like, for the future, but I think that's a hard thing. Like, you don't want your kid to struggle, but you want them to do their best and you want them to succeed, but they have to struggle in order to succeed.
Last question. I don't want to tie up too much of your night now that, you know, your daughter's
Having
to
so
bed.
much fun though.
I know, no, I
So
know. No, I know, me too. I'm having so much fun. This is such a good combo. And it's so insightful. It's so great to hear. So personally, I always struggle with like finding gifts for moms because I feel like when you type gifts for moms, it's like, oh, this spa basket. I'm like, no one's gonna use this spa basket. They don't have time for the spa basket. What's like gifts that you really appreciated getting or would appreciate getting when you have like a 1 year old, a 2 year old, a 3 year old?
so are you asking like gifts for mom or gifts for baby? Because
Gifts for both actually, because I'm kind of always like I don't know what they need because like I don't have a kid yet, so I don't really
right,
know.
right. And it's hard because like they're always at different stages and like development at different ages. So I guess let's start with mom. Gifts for mom, I always think it's a hard one, but if you can get her out of the house, or like in the
Really?
beginning it might be hard. It might be hard, but like you gotta, like, I really think like my good friends, like they were pushing me, and like sometimes it was like they were pushing me a little too hard, and I was like, I'm not ready for all that. Like, my best friend lives in Florida, and she was like, you go come to Miami for 2 days. And I was just like, I couldn't physically, I booked the ticket and I canceled. Like, I just couldn't
Oh,
physically, I wasn't mentally there yet. Like, I couldn't leave my child. Like, I would leave to school every day, but I would come home and I would like feel so much better. I needed that
right.
reassurance. But I think when I did kind of make that move, and like even to go for like a spa day with my friends, or like a dinner, and like just you get into this like mundane routine, and every day it's like groundhog day, it's the same.
Oh yeah.
The kids are on a schedule, they have a nap, they have to sleep, eat, you're like doing the same thing every day. It gets very repetitive. So if you could do something to kind of break that routine, I think that's really good and healthy, to get mom like a little bit out of her comfort zone for like the long run. If you can get somebody to watch the baby, and like I think a nice
Mm.
relaxing spa day with the girls is really nice. um
That's actually something that my sister said that I like witnessed as I spend more time with them and their kids, is she's like sometimes you get to a point, like I said, she has a 1 year old and a 3 year old. She's like some days like it's just like I wake up, I do the same thing because the kids need routine, right? She's like, I
yeah,
wake up, I do the same thing, I go to work, then it's all about coming home, getting the kids bathed, getting them fed, getting them to go to bed. Then
yeah,
it's like she's like every day I blink my eyes and it feels like my life is passing before me. And some days it's kind of
yeah.
like, what's the point of all this? It's just Groundhog Day living over.
Yeah.
How do you handle that? I guess, like you said, right? Like getting out
You
of the
gotta break
house.
it up. Yeah, like even I went to like a conference, and we made like a whole weekend trip out of it. And it was like our first like weekend away as a couple. And I was like, it was so refreshing. Like, we almost like we made use of every minute. Like, we planned like
Oh,
around the conference, like around the meetings, and like we drove up and we went to all the restaurants we wanted to go to. We went to like the cheesy like tourist attractions, and like it just felt good to like be a couple again and not be mom and dad, like to break out of that routine. Yeah, and also to remember like there is life, and also to to like venture out and also take the kids. Like, I would do a lot of things. Like, when she was like 8 months old, I took her to Florida. It's a 2 hour
mm,
flight, like just, or like a 2 hour car ride, like get out of the house with them, things like that. But it is hard, especially when you're working, you're like always in a rush, and like you just like it's hard to stop the time and appreciate. And always I tell everybody, like, take your vacation days. Like, guys, if you're in residency and you're listening to this, take your paid time off. Like, nobody will come to your like job interview and be like, they took 4 days off out of the six. Like, I actually saw a really cool gift, like from mom, baby, whatever. It's called like Meal Train. People do it. I
mm.
don't know if you've heard of it. It's like a website, and you could literally sign up on like a calendar, and you get like 10 or 15 people, or however many, and you sign up to like order meals, like breakfast, lunch, and dinner, or you cook
Oh.
the meals, and like you bring it to like the mom. So like that's something she doesn't have to think about, you know.
Right. That's so sweet. It's like kind of a way to organize your like your network, your friends and your family, and they all take turns like helping you out.
Exactly. Instead of everybody coming with trays to your house,
Right.
it's like on a website. I thought that was genius. I saw that and I was like, next kid, like totally gonna
Yeah.
do a meal train, or like for anybody as a gift. I think that's a super thoughtful gift.
So, where can everyone find you if they have any like questions? Like list your email if you want them to contact you through that or your Instagram.
Sure. My email is Dr. Ludy DDS. I can definitely put the link for that. And also, you can find me on Instagram at Jasmin Ludy anytime. I'm trying to be more active on TikTok. I'm trying to post like oral pathology stuff, like interesting the
Yes.
pathologies, and just like bring more awareness and like help the general public, and just talk about all the weird stuff that can happen in the oral cavity, and kind of tell you guys, why it's cool and what you can do, and just educate the public. So my TikTok is at Jasmin Ludy, and hopefully, we keep this thing rolling, and you guys can always hit me up, ask me any questions you want, and I love to help. And oh, also I'm doing a mentorship program for any young women in STEM. I'll drop the link for that too. I think the site is womeninbio.org. So I'm doing like a lecture series, and I also do one-on-one mentoring and counseling through that. So any young females who are interested in medicine, science, dentistry, anything, I love to support and help. So yeah.
Oh my gosh, that's awesome. That's going to be such a good opportunity for anyone that wants to do that. That's such a cool program. Oh my gosh. Well, thank you so much for your time. Your time honestly means so much, knowing like how limited it is and like how much you do. It's honestly just like an honor to be able to speak with you. So thank you for your time. And thank you to everyone for listening to today's episode. That is that for this week's episode. I'll see you guys next week. Bye.
Bye.